This podcast is proudly sponsored by Joro Protein, a Rhode Island plant-based protein supplement company designed for athletes and adventurers. They deliver 25 grams of protein, 5 grams of BCAAs, and 18 essential vitamins and minerals. It's non-GMO, it's gluten-free, it's allergen-free, no artificial flavors, no added sugar or stevia, and it has no additional gums, thickeners, or fillers. Right now, you can get 30% off on this podcast with the code JORO Rhody Strength 2022, and you can find them at joroprotein.com.
This podcast is brought to you by Phase CBD. That's P-H-A-Z-E. They are a local Rhode Island company who makes and manufactures a wide-ranging variety of CBD products that are formulated specifically for athletes. It doesn't matter if you're a CrossFitter, a strongman, bodybuilder, or powerlifter. These products are for you. These products range from tinctures to seltzers to even roll-on applicants. By supporting this business, you're supporting a local Rhode Island business and you're supporting this podcast directly. Please check them out at phasesports.com.
All right, what's going on, guys? Dr. Matt here, host of the Rhody Strength podcast. We have another special guest on today, Rick Olderman. How's it going?
I'm great. How are you?
Doing good, doing good. So just to give you a brief bio of Rick, Rick is a sports and orthopedic physical therapist. He has more than 25 years of experience, and he specializes in helping people with chronic pain experience a pain-free life. So great to have you on, Rick.
Thank you so much for having me, Matt.
Absolutely. Yeah, so I'm excited to get into it. And as usual, we're going to start with the rapid fire questions. Now, a lot of these are going to be basically based on, where your location is, or it could be pretty much anywhere in the country. But the first one I usually start off with, because I love coffee, is favorite coffee shop.
That would be Huckleberry.
Nice. Where is that?
We have one just about a mile and a half from us.
Cool.
Yeah.
And you're still in Colorado?
Yes, Denver.
Awesome. Very cool. I spent a little bit of time in Denver. I was doing a cross country road trip right when I graduated with a friend. We did a fly fishing trip and we stayed there for a little bit.
Oh, sweet.
We tented out in the mountains, and it was quite cold, even in September. I think it dropped below freezing.
Yeah, that's when it's going to start to get cold.
Yeah.
Hopefully you got some fish though.
we did. He's a much better fish than I, so he helped me out. He got me out some fish. And a follow-up question on that. What's your go-to? Like, do you do black? Do you do like a latte? How do you like it?
Straight black.
Cool. Same. And follow-up question to that: favorite go-to breakfast, either like a breakfast spot or maybe something that you make at your house.
One of my favorite breakfasts has become steel-cut oats with egg on top, and maybe some sausage in there, and a little bit of soy sauce and sesame oil.
Oh, that sounds delicious.
It's great. It's great.
That sounds really good.
Powers me up for my runs.
Yeah. One of my recent guests, it was similar. It wasn't a breakfast. Actually, no, it was a breakfast food. It was egg on rice. It was his breakfast.
Oh, yeah.
Egg on oats.
That's my second favorite. Just put it on brown rice.
That's a good call. Next question, we get into favorite Instagram accounts. Now, this could be, and if you hate Instagram, we can just move on to the next question, but this could be something that's entertaining, something that you found educational, or something that it pops up in your feed and you're just like inspired, or an account that you just like to see.
Well, this is where my dinosaur origins show is that I do not pay attention to Instagram.
That's fine. That's cool. How about any people in just maybe the PT or health and fitness field that you really like that you follow?
I don't. The way I've worked for the last 25 years, Matt, is I've pretty much had my head in a cave trying to figure out what we're going to be talking about.
Sure.
I don't really follow people, but the PT who has made the most difference in my life, and we can talk about this if you want to,
totally,
is Dr. Shirley Sahrmann and her work. And then another researcher that has made a big difference in my life is Thomas Myers, who wrote Anatomy Trains. And then the third researcher that made a big deal in my approach is Dr. Thomas Hanna, who studied neural tension and reflex patterns.
Cool. Very cool. I like it. Yeah, we'll definitely get into that.
Sure.
Next question I got is similar. We're on a podcast now. So are you a podcast listener, or maybe like an audio book listener? Maybe favorite podcast, or maybe a favorite recent book that you've liked?
Yeah. Yeah. I like listening to On Being with Krista Tippett. And because that gets into a more deeper kind of more, I'd say maybe spiritual aspects of life and thought. And then I just discovered Rich Roll podcast. And he is an ultra runner who primarily interviews athletes, but he is a deeper thinker. His podcasts are like 2 hours long. So you go deep into whoever he's talking to. And it's just really nice to hear in-depth interviews about how people tick, things like that. Totally. He's a really intelligent, sensitive podcaster. I like him a lot.
I like that style of podcast a lot.
Who has back pain, by the way?
Yeah. Oh, okay.
Yes. Right. And I contacted him. I liked him so much. I said, I love your podcast. I would love to help you with your back pain. And I think I can. And of course, I'm just small potatoes, and so he's not going to get back to me on that. But Rich, hey, if you're listening to Matt's podcast,
reach out.
Reach out, please. I can help you.
I like that. Worth a shot. And then last question. This is another one I like. Just for me personally. Any travel plans or coming up, or anywhere you've been recently that you liked?
Yeah. So I just took my son and 3 of his high school friends up to the Quetico National Park in Ontario, Canada. That's and we did a week, 7 nights of canoeing, camping, portaging, and fishing. And I've kind of gotten them hooked into fishing, no pun intended. And don't tell my wife this, but I'm contemplating asking her if I can go back again in September.
Nice, solid. That sounds like a great trip. That sounds awesome.
It is. It's amazing trip.
Very cool.
Yeah.
All right, so we'll get right into your history next. So kind of a broad question. I'm sure you've been asked it before, but how did you get into PT?
Yeah, so before I went to PT school, I had never even heard of PT. And I grew up on a farm in Ohio, and you just let nature take its course for most things. And so, but I had hurt my back, and again, I hadn't sought help from a PT because I really didn't know what it was. And then someone told me about PT, what they do, and I thought, oh, that sounds interesting. And so I went and volunteered, because as you know, you have to volunteer for a clinic before you can get in, even apply to school. So I thought, well, I'll just go apply and see what this is about. And it just amazed me. Well, one of the PTs there did a treatment for my back because he noticed that I was having some back pain that day. And it helped for a couple of weeks. And I thought, wow, I want to learn, but it came back again, and so, I decided that I wanted to go to PT school to not only try and figure out my problems, but this whole realm of I feel like, we're the infantry that's on the ground doing the work of solving pain. And that really appealed to me, this blend of medicine and sports and movement. I just felt this was a really good fit for me. So I cut to, I graduated, and my first job as a PT, I was out here in Colorado in a small town. And I don't know about your first year as a PT, but I felt like I was a miserable failure with anything that was remotely difficult, like back pain, sciatic pain, neck pain, headaches, things like that. And so, I got really depressed from it, because I was just like, this is what I thought my life's calling was. So I could either quit PT or try and figure this out. And so that's when I had this basic idea that we have pain because of how we're using our bodies. And so there was only one instructor that I knew of that taught about movement and pain, and that was Dr. Shirley Sahrmann out of the University of Washington in St. Louis, who's written 2 textbooks, one translated into 7 languages, published tons of research. And so I studied all of her stuff, and that just provided so much information about movement and pain. It transformed how I thought about pain. And then, as what happens, as you get better, tougher patients start knocking on your door. And so that happened to me, and her stuff was working, but not as well as it used to with these tougher patients. And then I discovered Thomas Myers' work in fascia. And he came, I don't know if have you studied him at all or looked at his information?
I'm familiar with the name, but I'm not definitely not an expert on his stuff.
Okay. So this is a really fascinating book he wrote called Anatomy Trains. And there he identifies superhighways of fascia running through the body. And you can dissect from the head to the toe, you can dissect this fascia as one contiguous piece of tissue that runs through all of the muscles and so forth. So he identified 3 identical patterns that Dr. Sarman had identified. I thought, oh, this is interesting. And then he helped me see that things further away from from where the pain was, what those other things might be, where those other solutions might be found further away from where people were experiencing pain. So I started getting more success. But then, of course, that next layer of difficult patient came up. And these were people who seemed to be locked in these patterns of movement and pain. And it seemed like there was a battery inside of them. Well, our battery is our nervous system, right? So I'm just like, what's going on here? And that's when I discovered Thomas Hanna's work and neural tension and reflex patterns in the body. And guess what? He identified the same 3 patterns that Dr. Sarman had and Thomas Myers had. So I thought, ding, 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 this is it. I've got movement, I've got fascia, and I've got neural tension patterns. And so I've put all of this together to form the way I practice now, which is called the Fixing You method. And that is, and I haven't, it's been so successful, I haven't felt I needed to look anywhere else. It's very effective. So
that's very cool. Question on one thing you had just said when you described almost like a battery inside them.
Yes.
What did you mean by that?
Well, what happens was I could fix a movement issue or a tension pattern in somebody, but it kept coming back again and again. And it was as if their muscles were contracting of their own volition, right? Where is this tension coming from, this muscle contraction pattern? If they're not generating it consciously, then it must be generated unconsciously somewhere. And that's what Dr. Thomas Hanna's Somatics taught me how to unravel and think about.
Gotcha. Very cool.
Did that make sense?
Yeah.
Okay.
So when you say a battery inside them, something that's a battery that's shouldn't be there, that's continuing to have an outside power source of why the muscles are tense. Is that essentially what
that's basically it? But essentially it's our brain, right?
Okay, sure.
Our brain is the master nervous system controller. And so for some reason, the brain is sending these signals of repeated contraction. Even if you break the pattern of contraction and it comes back again, it keeps sending the same pattern. What's going on there? Why is that happening? And so that's when I sought out this. I needed another answer because Dr. Sarman's information taught me about movement mechanics, but it didn't talk about the organization of those mechanics.
Sure.
And Thomas Myers taught me about fascia, this connective tissue in the body, but it didn't teach me about why the fascia is becoming contracted. And so this is the piece that Dr. Thomas Hanna's information taught me. It started giving me the neurological reasons underlying why the contraction patterns were happening.
Gotcha. Okay.
So, and what's interesting is they look at everything from strictly this reflexive neural tension based point of view. So they don't really understand biomechanics of how that affects pain and tension, right? But I knew that from Dr. Sarman's work. And then, Dr. Sarman doesn't really incorporate this neural tension thing or the fascia stuff, right? And so I was just putting all of these 3 things together since they all spoke to each other. All 3 came up with identical patterns. I'm just like, this can't be a coincidence, Yeah,
that's interesting you say that, because I almost feel like the current state of PT is, in a way, it's very sure the internet has brought everybody's ideas together, but in a way it also has identified like different groups of people, like, oh, I believe it's just this is the main issue versus this is the main issue, and you've almost seemed to bring all those together. For example, there's like a lot of PTs, especially in the outpatient ortho, are just strictly focused on biomechanics. They don't think about the neural, or a lot of them even dismiss the manual therapy side of it with almost like the anatomy trains of like, oh, that's not even important. But then you have the opposite side, and then it's only manual work that's going to really help someone. versus, you brought all three of those together, which is really cool.
I'll tell you, I'm not I wouldn't call myself a manual therapist in that I don't manipulate joints, and because I found it's not necessary. Once you understand how our systems work together, you can unlock and unfold all of these systems without aggressive manual work like that. I do manual work, but it's of a different kind.
Sure.
And so, and I find, and I'm certified in dry needling. I think you are too, right?
Yep.
Yeah. I find that I'm doing less and less dry needling as I understand the body more and more. And my dry needling is becoming, the little bit that I do is becoming more precise, because I understand precisely where that hitch is. And so that's been helpful too.
Yeah. Your mention of dry needling was interesting too, because you had said something earlier about how, back to your analogy with the battery, like with the muscle, it just stays tense. And there's that outside neural stimulus. And I know the needling course I took was through Evidence in Motion. And that was one of their big things they had said was, early on in the days of needling, they thought we were really kind of like breaking up scar tissue. And the more research they've done, that's still a theory, but the theory they think is more prevalent is that, okay, we're kind of putting a reset on some of these neurological signals that are coming from the brain that keep, activating this muscle. But they don't really get into anything deeper than that. Okay, like why is that happening? So yeah, I had thought about that when you mentioned it. So funny for you to bring up dry needling.
Yeah, no, I think that's correct. I think dry needling is a method of breaking that reflex loop that's causing this contraction pattern. But what I have learned, how I've learned to think about pain, is I keep asking myself, why is that happening though in the first place? It's not enough to break that reflex loop. We need to know why that reflex loop is occurring.
Sure.
And if we can answer that question and solve that, then we don't need to do dry needling anymore. Right? And then we don't need to do a whole bunch of things anymore if we get down to the nitty gritty of the why something is occurring. And usually, and this is where I talk. So what I call my approach is more of a systems approach to solving pain. And I think we're trained as physical therapists, and this was my thing this was the difficulty I had, was we're trained as physical therapists to look at the body in terms of components. Oh, this is what you do for elbow pain. This is what you do for shoulder pain. This is what you do for back pain. This is what you do for neck pain, right? And that's based, and we're all taught you need to be evidence-based, right? So evidence, though, by the nature of its existence, is something that's looking at something very small. You can't look at broad systems with a research double-blind study, because you've got to distill it
one
down
thing at a time.
Yeah, exactly. You can only look at one thing at a time. But what I've discovered is that there's a whole bunch of information about all those little one things, but there's hardly anything out there putting it back into the whole system again. And so that's what I've been doing this last 25 years, is saying, that's interesting evidence. How is that going to work in my system or my patient's systems? Is it meaningful or is it not? And so that's why I call this systems thinking as opposed to component thinking, which is how we're trained to do it. And medicine in general is trained, because it's all based on research and evidence.
Sure.
Right. So that's broad strokes.
I like that. And in a way, because you have an actual systemized approach to this, you're in a way conducting your own experiment of like, okay, I'm using this system. I'm sure over time it's evolved. And you're like, okay, yes, the results I'm getting from this system. Now I've changed the system. These are the results I'm getting from this system. So
yes. So early on, I was like you. I was cash pay physical therapist, and people would come to my house to get treatment. But I thought, okay, well, these are highly motivated people. They're willing to pay me cash, So anyway, sorry about that. They're willing to pay me cash. So I'm just like, well, is this a different population than I would see in an orthopedic clinic setting? And so I ended up buying an orthopedic clinic to go test all my theories. And so, we quadrupled our business in like 4 or 5 years. So because people were getting better fast. But then the next question was, can I train other people, other therapists to do this? I don't want something that, because people will say, oh, you're so gifted. No, it's not a gift. It's about having the right information.
Mm-hmm.
And so can I transmit this information to other therapists? And yes, they got the same results that I did. So I've developed a training program to teach other people this approach as well.
Very cool. Yeah, I think there's a lot of studies out there showing that, like, yeah, there's a lot of back pain. Like, let's use backs, for example.
Mm-hmm.
There's a lot of back pain out there, and we have a lot of treatments for it. But in general, as a whole, as a healthcare system, we're not very good at treating it. We throw a lot of money at it, but we're not very good at treating it.
Yeah. Can we go down that just briefly?
Totally.
So some of your listeners may have back pain. As you know, it's one of the most common causes of pain that we experience, right? So here's an example of what I'm talking about. So here's a little test. If your listeners just lie down on their backs right now and with their legs straight and feel what their back feels like for like 20 seconds. All right, even while I'm talking right now, if they want to do it, they can lie down on the floor, on the couch, on the bed, doesn't really matter. Just have your legs straight and then bend their knees. All right, put their feet flat on the floor, or you can hug your knees to your chest. Which one feels better for your back? Do you have any ideas, Matt? Which position would feel better, legs straight or knees bent?
Me personally, just from doing yoga, I would probably say knees bent.
You're exactly right. That's 99% of the people out there with back pain feel relief when their knees are bent in this position. So what are we doing to the spine to make that? Why is that a difference between legs straight and knees bent? It's this simple thing. The back is flatter against the floor. There's less arch, right? There are less forces trying to pull it into an arch. And so Dr. Sarman identifies this as an extension problem, which means that your back is too arched. But it's not so much the shape of your back being too arched. It means that you have too many forces pulling your back into an arch. So let's say that we've established that you have this too much arching phenomenon going on. And that's one of the reasons why you're having back pain. So if your people now just stand up, all right, and just stand up and listen to me for a little while and just stand there. You don't have to do anything. And now while you're standing there, I want you to notice, are your knees locked straight or are they soft? And so, Matt, if you stand up yourself, go ahead and try this out. Let's say you just told me that your back feels better with less arch, right? Do you tend to lock your knees or not?
I would say I try not to, just because I'm pretty conscious of it.
Aware. Okay.
Yeah.
So we'll continue the test. So stay there. So your knees are, let's say your knees are straight. Go ahead and straighten them out and feel what just happened to your back.
My back arched.
Right. But you just told me that your back arching makes it hurt more. Right?
Sure.
So now unlock the knees and make them softer.
Yep.
You feel the difference in your back?
Yeah. Better.
Okay. And for those of you who didn't feel the difference, now lock your knees one more time and you'll feel that your back arches. So if you did that first test and you found that your back hurts more when it's arched than when it's flat, and then you just discovered that when your knees are locked straight, that your back is arching more. That is a systems thinking approach to understanding why you're having back pain. It's not because you have a disc bulge or facet joint arthritis or a strained multifidus or any other micro things. It's the bigger picture of things that you're doing about how you're using your body that's contributing to that pattern of back arching that's then causing your back pain.
Totally.
Does that make sense?
I like that a lot. I think exactly what you had just said in the last piece, like people get too hung up on, I think probably because it's just the easiest explanation for their pain. Like, oh, we did an MRI, there's a disc. Oh, I pulled a muscle, it's a multifidi. Oh, it's like arthritis. And they identify like, oh, that's the single cause of the issue. When I guess we can talk about that for a second, was like, there's been a lot of research showing that, yes, the x-ray is going to show this, but this is actually a relatively normal occurrence as the back's aging or as you're an active person, like your bones, your joints, that things are going to look different, but it doesn't mean they're necessarily dysfunctional or injured.
Absolutely. Absolutely. So I even believe that, that these systemic things that are causing these dysfunctional movement patterns are the things that are causing those bulges, herniations, and facet joint breakdown to occur, because they're just causing excessive compression, stress to the spine. And Wolff's Law states that the body responds to stresses placed on it, right?
Sure.
So if you go through your life and not unaware of the stresses you're putting on your back, and you're creating all these stresses, that's, I think, one of the reasons a lot of these things are happening. So I think it would be a great research study to find these people with disc bulges, correct their way of using their body, eliminate their pain. And in 6 months or a year, go back and X-ray or MRI them to see if their disc bulges or, arthritic changes have disappeared or lessened.
Right.
That would be fascinating. But no one ever does that because they're out of pain, right?
Right.
No insurance company is going to pay for a test when you're out of pain.
Right.
So, yeah.
I did see a study recently. There's a guy, Dan Pope, I follow on Instagram, and he reposted a study, because you're right, there aren't many studies out there like that. But there was one recently with MRIs and disc bulges, herniations. I don't know if you've seen this one recently, but because early on, like years and years ago, people had no idea that they think they didn't heal at all. And they've found, especially the most severe cases have the highest chance of healing. And they went into the MRI and they saw the herniated discs had actually scarred over and they looked relatively normal, in a lot of people that had healing, which is incredible. Yeah.
So if you think about Wolff's Law again, if our body adapts to stresses placed on it, then it will also adapt to stresses that are removed from it. Right? So your body is an amazing healing machine. If we fix the problems, the obstacles that are in front of it that are causing the pain and breakdown, then the body has within itself the ability to heal a lot of these issues. Just like when you cut your finger and it heals, or a bone mends, it happens all over the place all the time. We're constantly repairing ourselves.
I like that. I've never heard of Wolff's Law been put in reverse like that, but it makes total sense.
Yeah, doesn't it?
I love Wolff's Law. That's one of my favorite ones to explain to clients, like, because a lot of people don't realize, everyone knows, like, you go to the gym, your muscles get stronger, but also that, over time the tendons will improve strength, the ligaments will improve strength, because you are putting your body through that adaptation, and the body responds to stress in a positive way.
Right.
So that's really cool.
Yeah.
Let's take a quick break, and then we'll come back for round 2, a few more questions on the Fixing 2 series.
There we go.
Hey, welcome back.
You look familiar.
All right, so we are back from our break. And I kind of want to get into more of the Fixing You system, and kind of, I guess, basically what is the Fixing You system? I know we explained how you arrived at that, but I guess what is the system? I looked into your system a little bit. You had it broken down into each body part, but I guess if you can give like a summary of like your overall system that you use.
Sure. So I call this systems approach to solving pain the Fixing You method. And basically what it is just kind of how we've been describing, is that let's go back to that example of the back pain that we had earlier. Okay. Sure. We just learned that our back is more painful when it's arched than when it's flat. And we just learned that locking the knees when you stand or walk is going to cause the back to arch more, which then contributes to more back pain. All right. But locking the knees also does other things to other muscles. One of the things it does is it tends to shorten your thigh muscles a little bit, and it turns off your butt muscles. Okay. So the Fixing You system is not only just about changing how we're using our body, but we've got to fix the mechanical problems we've created because of how we've used our body. And so, it does involve a few stretches and strengthening exercises, but because we look at things from a system standpoint, and I've been experimenting with this for so long, I've drilled down to very specific exercises to correct very specific problems that have a large ripple effect in the body. So in PT school, and this is what actually happens when I get someone who comes into my clinic who's been to a lot of other therapists, they'll often bring a binder of exercises that all of their therapists have given them. And it's multiple pages, right? Well, this is because it's a non-specific addressing of a problem. We're just throwing, oh, I think you've got something going on with your glute muscles. Let's give you these 5 exercises to work on all of these hip muscles, right? Well, it's you don't need all 5 of those. You just need one to address the specific problem that you've identified from a system standpoint. And you just need this one stretch for your thigh muscles to solve this problem that's also contributing to this arching of yours. So it becomes much more streamlined. So the fixing you method is taking into account the changes that have occurred in the muscles, whether they've become too tight, too loose, too weak, overly active, that kind of stuff. So it addresses those specific muscles. And then it's also fixing the habits aspect of things, teaching people how to use their bodies better to remove the strain and not make these muscles tight or weak or loose or whatever again. So it's a two-pronged attack. And then what I've also done is I've developed taping techniques based on my understanding of how our body works as a system that bridge function. So basically the taping gets people there faster. It gets them to feel what their bodies would feel like if everything was working perfectly. The taping does that for them. And then as they do the exercises to correct whatever it is we're correcting from either a movement or stretching or strengthening standpoint, then you gradually wean yourself from the tape because it's no longer needed. Your body's doing it the way it should. But the tape gives the patient an idea of how am I going to feel? Like, let's say my theory is you're having back pain because I think your left foot is too pronated or too flat. So if I'm correct and I correct that foot pronation, that should change your back pain. Okay. So that's how I use taping. It either confirms or denies my theory of one of the issues that's creating your back pain. And so if I tape it, because I know my taping technique is very good, it's going to fix that foot pronation. But if it doesn't fix their back pain, then I know the foot isn't the major player for their back pain. All right. And so I keep working up. My examination has uncovered all of these potential culprits. Which one is the most important one varies from person to person a little bit. It's usually a very similar thing though. Gotcha. So that's the approach. Is it fixes movement habits, strength or weakness or tightness, and then we use taping as a bridge to get you where you need to be fast.
And just a quick question on that: so I'm sure you see people remotely as well.
Oh yeah.
Do you teach them like a self-taping technique?
Yes. Yeah. So all of my downloadable programs there's a little thing called Extra Help. And that's where all the taping recommendations are. So I teach, the taping techniques in those videos, and you can either do it yourself and I teach a way for others to do it for you.
Very cool.
Yeah.
The taping's interesting because I feel like it hit a huge burst in popularity maybe a few years ago. And now I feel like it's kind of waned, and it went from being like, oh, this is the best stuff ever to this is just a placebo. And I think now it's kind of settled somewhere in the middle. Like, yeah. I still use it. I think it's pretty effective. I think along your point, I think it's really good at giving people a sense of their body, like where it is in space, and allows them to adjust their movement patterns kind of accordingly.
Well, to geek out just a tiny bit about
Go for it.
All right. So the taping methods that gained a lot of popularity were the KT taping or kinesio taping techniques. That's not the kind of taping I'm talking about.
Gotcha.
Kinesio taping is good for guiding movement, as you say, but a piece of kinesio tape is never going to hold up a foot arch, right? And it's never going to hold up a shoulder blade. It's never going to stop you from locking your knees. So for that type of stuff where I need to actually make the body do something different, force it to, that's when I use the cover roll stretch and Leukotape P. So the majority of my taping is using that tape. The kinesio I use for other things that I can get away without actually trying to change too aggressively.
Sure. That makes a lot of sense.
Yeah.
Cool. A question along those lines. I know you said you worked with a lot of patients that are really complicated, and I know those types of things, people don't get results overnight, especially with that type of stuff. How are you able? I think from what I found, I think the biggest difficulty with getting people better is for them to comply to a program or buy into a program over a long period of time. And like buy into do things consistently in order to kind of make progress. How did you find, have you found any ways that either are helpful in that or anything that kind of like draws away from that?
Yeah, I get them to comply by getting them better fast. All right.
Fair enough.
Nothing helps compliance than getting better.
Yeah.
Right.
Yeah.
That's where the rubber hits the road. So my standard, if I see a person, I don't care if they've had chronic pain for 30 years, if they're not 30 to 50% better after my first visit, then I start looking somewhere else. I'm looking at one of the other culprits I've identified, and I'm going to see if they're actually doing what I've asked them to do. So involved with all of this whole approach is test retest. So if you have pain doing X, and then I think this is why you're having pain doing that, and I modify that, and your pain is diminished by 50%, that shows us both that I'm on the right track and you are too.
Sure.
Right. So then they get the buy-in, like, holy smokes, that just happened in 5 minutes. Okay, I'm going to do this because it showed me that it felt better. All right. So the length of time, so people have been led to believe that the longer that they've been in pain means the longer it's going to take them to feel better. Not so. I just had an NFL lineman I treated. He he came in for a myriad of issues, but this particular issue was his hip. And he had hip pain since he was in college. Well, after drilling down a little bit deeper, I found out why. But anyway, it turns out that he had a retroverted femur in the leg, in the thigh bone of the leg that he was having hip pain in. But his training techniques did not account for that. Retroversion is an outwardly twisting of the thigh bone. So he had one bone that was slightly outwardly twisted and the other thigh bone was not. But his training techniques did not accommodate that structural change in his body. I didn't even touch the guy. You can imagine how big his thigh was. He was 350 pounds, huge. His thigh was as big as my torso. I'm not about to try and move something in his hip, right? With that kind of size. So all I did was educate him about how his femur shape was. And then we looked at his stance and his training techniques for his weight training. And we made slight adaptations in his training techniques to accommodate for that retroversion. Within 3 days, 75% better.
Awesome.
All right. So this is from a highly trained athlete who is still going to practice. So he's practicing full go while he's making these changes, and he got 75% better. So pain is an indication that something is wrong now. And so if they're not responding to what I'm giving them, then I must be thinking about this wrong. Because I've seen so often people respond quickly that it's not acceptable for me, a 10% increase or a 20% increase or decrease in pain. I mean, for me, if someone tells me that they're 20% better, I think they're trying to save my feelings, because I think they're actually 5 or 10% better, maybe, sure, if at all, right? Sure. They're just trying to make me feel better because they don't, want me to feel bad. That's not acceptable. My 30% is the least amount I expect after one. So your question about compliance becomes a non-issue when you show people exactly what it's going to take to get them better.
Sure. I like that. I think that's really good. I really like the test retest too, because there's a decent amount of workshops I do. And I think the test retest is really eye-opening for people, especially I do a lot of kind of like the Kelly Starrett type of, lacrosse ball, foam roller, some of his early on techniques, just to kind of show like, hey, if we can mobilize this tissue, look at the range of motion we can achieve. And for people to just witness that and be like, oh, wow, this is, he knows what he's talking about. This is actually effective. Mm-hmm. And obviously that's not the the one and done, the only thing you do. But
Sure.
if you have a couple of those techniques to show people like, hey, these types of things can help, it can be huge.
Yeah. It is huge.
So a separate question, kind of along those lines of, I know we're talking a little bit about like chronic pain. I flipped through some of your PDFs that Nico had sent over, and I saw you had a lot on, at least in the beginning of the PDF, was a piece on like mindful healing and breathing. And I think I know, but maybe you can talk about that a little bit as far as maybe its effect on the nervous system and pain.
Yeah. So so I have a theory that I put forth in my back pain book about emotional trauma and stress and chronic pain. And so what I think is happening, if you remember, we talked a little bit about Thomas Myers' work with fascia. All right. Well, there's different types of fascia, and there's a type of fascia that's generated by myofibroblasts, and those have up to 4 times the contractile capacity of normal fascia. Myofibroblasts are laid down in areas of mechanical stress in the body. So we have a higher concentration of those, for instance, in the thoracolumbar fascia in our low backs, because that's the meeting of 2 different curves and the center of movement for us, right? So we need a lot of control. So there's something that your immune system releases called transforming growth factor beta 1 under times of stress. Well, emotional trauma, I believe, counts as stress. So when transforming growth factor beta 1 is released in the system, it travels through our system like through the bloodstream. All right. So what contracts myofibroblasts is not neural input. It's a chemical input, and it's transforming growth factor beta 1. So if we are constantly stressed, we are constantly engaging those areas of our body that are under more mechanical stress, that have laid down more of these myofibroblasts, all right, which then cause it to contract more. This is one of the batteries I was talking about that cause chronic contraction patterns. And based on our history, different people have different areas of myofibroblast concentration, all right? So when I talk about mindful healing and breathing, what we do, for instance, if you exhale twice as long as you inhale, you're stimulating the parasympathetic nervous system, right? Which is our rest and digest nervous system. So what you're also doing is, I believe, reducing your stress response. If your stress response is reduced, then the transforming growth factor beta 1 is released less, which then disengages the myofibroblasts more. So the more that you can practice mindfulness and calmness and stimulating your parasympathetic nervous system, just removing that layer of contraction in your body by not stimulating these myofibroblasts will go a long way to reducing chronic tension that causes pain in your body. Does that make sense?
That's very cool. Yeah. That's way different of an answer than I was expecting. I thought you were going to go a little more. I mean, you talked about the parasympathetic system, but what did you say? The beta growth factor?
Transforming growth factor beta 1.
Yeah, that's something I had never heard of before. But I use breathing as far as techniques for people too. Same thing as in response to stress, and I think there's been really good research on if you're stuck in that sympathetic system all day, you're not recovering, your body's not healing. But to get into the nitty gritty of exactly why that's happening, that's some really cool stuff. I like that.
Well, I think there's lots of talk about the mind body connection, but there's no one saying what that connection is.
Sure.
And how does it work? And there's no one using that connection to solve pain. If you understand, and this is only my theory by piecing together the research that's out there, but I believe this is how the mind and body are connected, at least in one way, to create pain. Maybe not the only way, but it's certainly a strong, very strong possibility that this is what's going on with chronic neural tension or chronic contraction in your body unconsciously. All right. So anyway, so the nice thing is that this also works in reverse, kind of like Wolff's Law. If you can relax the areas of tension in the body, that will then decrease the amount of stress that your brain is experiencing too, because it's a feedback loop. So it works both ways, like that yin and yang symbol. Sure. Everything's in balance always. And so, solve the stress at the brain level, that helps your body. Solve the stress at the body level, that helps your brain. It's all connected.
Totally. Love it. Yeah. And kind of going full circle, we talked about how, back pain is poorly solved in America and probably worldwide. I think pain is poorly understood, and I think we're doing better. But it's still one of, conditions like, let's say, like fibromyalgia or chronic pain are just very, very, very poorly understood conditions. So if we can, better understand them and better put a treatment like system, like you've said, that's huge.
Well, this is one of the disturbing things that I'm seeing more and more in research is they're classifying chronic pain as a disease. It's not a disease. And what I think is that's an easy way out from us understanding what is causing chronic pain. Oh, well, I can't solve it, so it must be a disease. No, it's not a disease. It's our lack of understanding of what to do is why there's chronic pain. But this system works really well. And if you don't, I'd love to just talk to you a little bit about this, why we have sciatic pain or SI joint pain or unilateral back pain, because that's a different pattern of problems.
Yeah, let's hear it.
Okay. So there's something called a side bending problem. And what it means is when one hip is higher than the other, typically the same side rib cage is lower. Next time you go and work with a patient, Matt, who has unilateral back pain, sciatic pain, or SI joint pain, even hip pain, knee pain, or foot pain on one side, check to see whether their pelvis is higher on that side. I will almost guarantee that it is. And if you go, and this is what a few PTs check, is that the rib cage is also lower on that side. And the longer this pattern has been around, you'll see a bigger crease on one side of the back than you will on the other. So in physical therapy, what we're trained to think of this as is a rotated back spine problem, right? Because these muscles look bigger than this side. But if you remember your neutral spinal mechanics, side bending equals opposite side rotation. The side bending is the driver of the rotation. Solving the rotation is a temporary fix. It never sticks. Solving the side bending is a permanent solution. It always sticks. So the question then is, why is the side bending problem happening? And you can imagine that if this is happening, it's going to compress those nerve roots at the spinal level, right? It could also cause dysfunction in the SI joint because you've got a pelvis that's off kilter. It can cause piriformis dysfunction, causing piriformis syndrome types of things. So, or unilateral back pain. So why is this happening? Well, this goes back to Thomas Hanna's work. This is a trauma reflex pattern. If you step on a tack on this foot, your body is going to say, ouch, and it's going to hike that up. So if we have an old unresolved injury here somewhere that hasn't been treated correctly, your body's going to slowly respond by causing this pattern to occur. Then someday you pick up that pencil the wrong way and zing, you've got sciatic pain that never leaves. Why is it not leaving? Because we keep treating the sciatic nerve somewhere in the spine, right? Well, yes, you can correct the pattern, but it will just keep coming back again and again. What you've got to solve are the older problems that cause this whole pattern to happen in the first place. It's hugely successful, but I've just found this is not taught in training courses, this pattern of dysfunction. But if you, now that you know it, if you start looking for it in your gym and practice, you'll probably see it in any unilateral issue that you find in the gym, whether they've got sciatic pain or not. You'll find that the body has started to adapt by having this pattern occur. It's easily corrected.
Yeah,
it's behind almost all unilateral pain like that.
I haven't heard it explained that way, and I really like that. And I'm curious on your thoughts on this. So I know a lot of really good chiropractors, and I know you're not a big into manipulation, but you do manipulate, and you said you get away from it the more you're able to help the person more and more. You don't need as much of the hands-on techniques. If I'm saying that right.
I don't manipulate. I have other manual skills that I use.
Right. So
these things.
So I have a lot of people who will come to me who maybe had previously seen a chiro or previously seen another provider. I don't want to isolate chiros in this, but they'll say, "Oh, my hips are off. They're out of alignment. They're out of socket." And I know from just the research that's come out in the past few years, I'm like, well, I know that they feel like they're out of socket. They feel like they've dislodged or they're out of alignment. But in essence, what we've really come to find out is it's more of just muscle tightness that's kind of rotated you. You're not dislocated like a shoulder. We don't need to kind of pop you back into place. Although that will help you relax the muscles. I think a big thing to tell the patients, tell the clients, are just so they don't get kind of locked into this, oh, I need to be popped in order to get back put in place, like the Tin Man. But to along the lines of what you're saying, that makes perfect sense of okay, if you feel like you're out of place, you probably have that side bend rotation tightness.
Correct. And
yeah, sure, manipulation will help you kind of relax, but I think it's important to say that, okay, my hands aren't putting the block back where it needs to be. It's more of just my hands are able to help your nervous system relax a little bit, maybe, and get you back into position. Is that about right? Would you agree with that? Or
I would agree with that. But it's even more useful if you relax the things in strategic points and fix the reason why it's tense in the first place.
Sure.
And that's what this whole thing does. Do you mind if I speak about leg length discrepancy? Because you're
go for it.
Okay. This is another, this is a little pet peeve of mine. I have lots of people coming into my clinic. Oh, I've got a leg length discrepancy, and they've got this big heel lift there. Well, lo and behold, oh yeah, your pelvis is up higher than the other side. So that's why I've got a leg length discrepancy and have to wear this thing. I said, and so I measure every single person who says that they have this. And in my 25 years of practice, I've maybe had 5 people who have ever had a true leg length discrepancy. So what is going on here? Okay, so what's going on here is that we look at someone from a functional standpoint, and I'm going to step back. So if I'm looking at someone and I see a pelvis that's higher on this side, but the foot is flat on the ground, I'm going to assume, oh, well, you've got a longer leg on that side. No, because how many joints are we looking at here? We're looking at 1, 2, 3, and then add 26 in the foot. All right. Yep. So not to mention the SI joint and the rotation of the ilium that can occur. So that's, another one. So I think people are either measuring from the top of the pelvis to the bottom of the foot just with their eyes, or, I think that's what must be happening, because I don't understand why people are saying this. So the way I measure leg length is if you measure from the greater trochanter, from the top of the thigh bone to the fibular head at the bottom of the ankle here, that's measuring the actual leg, right? That's true leg length. Not when you include the pelvis in it, not when you include a pronating or supinating foot in it. How is that? That's going to throw everything off. That's not really your leg. You're talking about the whole lower extremity if you're doing that. But so there's so many problems that can occur that cause rotations and changes in what's happening in these joints. Looking at the pelvis is not how you look at that. And so I even had a woman bring in an x-ray from her doctor, a full length x-ray of her child showing, oh, look, there's that side of the pelvis that's higher than the other. Well, I could see the rotations that were occurring in the child's leg. We fixed it in 5 minutes. And she brought the child in because they were having balance issues. And she thought that she had a sensory processing disorder and all this kind of stuff. Well, fixing the issue that was causing the apparent leg length discrepancy solved all the balance issues almost immediately. So I had her jumping on one foot, getting on a Bosu ball, jumping on one foot, all the things. And, the mother couldn't believe it. So there's this huge myth out here about, and then so sticking a heel lift, when you don't have an actual leg length discrepancy, sticking a heel lift under one foot is going to make things even worse, right? So there's my little pet peeve about leg length discrepancy. And,
totally.
trying to affect those kinds of things. So I've got a million of them.
Yeah, I like that. I like that a lot. I see that. I definitely see that too. People come in and say, "Oh, my legs are different lengths." I'm like, all right, well, let's see.
Yeah, exactly. Yeah.
I had a couple other things written down. I won't keep you too much longer because we are reaching towards the top of the hour. I know we already talked a little bit about kind of what is evidence-based. We talked a little bit about I guess we didn't get into this too much, but one of the things I picked up from I think it was either on your website or your PDF was the statement you said, I can help you eliminate pain naturally without surgery or medication. And I don't know if I really have a question on that, but I would say without surgery or medication, I feel like that's kind of become the easy fast track for a lot of issues. But a lot of times people end up coming back into the same system that they were in, or the same pain system they were in, even after getting the surgery, or after getting the medication. So
absolutely,
yeah.
Right. Solving things from a system standpoint makes the surgical outcomes much better because they're not returning to the same old pattern of movement that caused the problem in the first place. This is why a lot of surgeries are failing.
Yeah. And I know recently there's been a couple studies that they've been put out on, and I mean, every study has different, obviously, validity to it. So you can't use one study, but I think it was the AC joint decompression surgery. They're saying like, oh, the results are kind of, they're not as good as we thought they once were. And the knee meniscus surgeries are the same, especially with the adult population. They're saying, oh, with and without the surgery, a lot of times you're getting the same results.
Mm-hmm.
So, which I guess leads me on to one kind of follow-up question there. Let's say, do you have any other healthcare providers that you kind of refer out to, or do you have like some orthopedics that if someone needs a additional help, or like recommend imaging, or do you collaborate with any other providers in that way?
Well, yeah, I had a internal medicine group. They sent me all of their tough patients to my clinic, and they've learned to trust me. So when I ask for an MRI or something, they hop on it, and usually I don't ask for those things lightly. So I mean, I trust every doctor out there to do the right thing, and I found that when I ask for something, generally it's given me, because I don't just, because the doctors know I'm doing a comprehensive exam, and they know that I'm doing this comprehensive fix of whatever problem there is. So they're more likely to say yes to what I'm asking for. So I find great, collaboration with almost all medical professionals.
Awesome.
In that regard. Yeah.
That's really cool. All right. I guess, unless you have any other major points that you didn't want to leave out, I think we can kind of transition to the wrap up.
Sure. Yeah.
Cool.
Unless there's a particular injury that you're struggling with, or that you're struggling with a patient with in your practice.
I personally have a little bit, I had a surgery on my left shoulder.
I can tell.
We'll make it kind of quick, but that's actually my good side, because until about 2 weeks ago, my right shoulder, I'm competing in a Olympic weightlifting meet, Olympic style, not the Olympics, but Olympic style weightlifting meet this Saturday. And about 2 weeks ago, as I was peaking for my training, I'm guessing you're a runner from a couple of running references.
A little bit.
So the training is kind of similar for a race, like for a weightlifting, like you build volume, you peak, and then you have a deload, and then you compete. But yeah, so I was hitting my peak, and a lot of times with running, like you feel kind of crappy during that peak phase. So I was feeling it with my shoulder. I'm like, it's just, I'm just had a lot of volume right now, no problem. But 2 weeks have gone by. I'm like, gosh, shit, it still hurts. And the competition's in the 4 days. So probably not going to be my best meet. But yeah, that's the one thing that's bothering me right now. But I have things kind of pop up here and there. I kind of bump my head into the wall quite often with working out.
Let me ask you this,
my personality.
Matt. Yeah. Are you right-handed or left-handed?
Right-handed.
Yeah. So your left shoulder, something's wrong with your left shoulder there.
Yeah,
undoubtedly your right shoulder. I mean, I believe that something's wrong with your right too. But what I'm going to do is I'm going to send you my scapular taping technique. I'm going to send you that video, and I'd like you to try it to see if it takes away any of this pain of your shoulder, because it could be a scapular issue, judging by the relative height of your shoulders that I'm seeing.
Sure. Oh, that'd be awesome.
So just try that out and stay in touch with me, and let's see if that helps you. Okay?
That'd be something different that I don't that I'm less familiar about. So that'd be really cool.
Yeah.
All right. So let's we'll start to wrap it up here. So I've one we'll try. I'm gonna try to keep you on a timer for this one because we're running out of time on Zoom. Sure. But what's one thing, and we could have already discussed it, so if we can move on quickly. But what's one thing that people think is true about physical therapy that you believe most people are actually mistaken, or I guess one common misconception?
That we're all the same.
I like that.
How's that for short?
I like it. Beautiful. All right. Everyone deserves a little individualization, a little custom.
It's like eating at McDonald's and thinking all restaurants are the same.
I like that. That's good. And then I know we had one more follow-up question. This is from Tim Ferriss. You get a billboard. Our big billboard in Rhode Island's 95. I don't know what your major highway is there where you're at in Colorado, but you get a billboard on that, and you get to basically put a message out, maybe a favorite quote, mantra, saying to the people kind of in your community or anywhere.
It would be, you are not broken. You just haven't received the right information yet.
That's fantastic. That's huge. All right. And so we'll start to wrap it up here. I know just a couple things that you might want to plug or shout out. So we got rickolderman.com, the Fixing You series books, or I guess I'll let you kind of talk a little bit about that.
Yeah, so if people want to get my downloadable home programs, and I recommend those over the books because they're more current, and it will speed things up for you quite a bit. So you can visit fixingyouMethod.com to get those downloadable home programs. If you're a practitioner who wants to learn this way of looking at the body, you can go to healpatientsfaster.com. And if you can't remember either of those, just go to rickolderman.com, and everything's there, as well as some free stuff.
Awesome. And the Talk About Pain podcast too?
Yes. Yeah, there's a link to that as well.
Very cool. Awesome. Well, I think that wraps it up. Rick, it's been awesome talking to you.
I've really enjoyed myself, Matt. Thank you. Yeah,
I really appreciate it. Cool.